Caffeine is a stimulant that's chemically similar to the neuromodulator known as adenosine, which accumulates throughout the day and induces drowsiness for sleep. When we consume caffeine, it binds to adenosine receptors in the brain, blocking the effects of it, with the side benefit of allowing dopamine to flow freely. That can bring on feelings of well-being, energy, and alertness. Caffeine is a common stimulant found in many plants. It can help reduce fatigue and appears to improve performance for certain tasks, especially for someone who is tired. It's said that coffee consumption has a consistent association with lower risk of depression and cognitive disorders. Coffee is one of the most commonly consumed drinks in the world. According to the US National Coffee Association, Americans spent $72.4 billion on coffee in 2015 alone. Drinking coffee is generally accepted as safe with reasonable levels of intake. However, higher amounts of consumption may have negative effects. Though research on caffeine and depression is in its early stages, there seems to be a suggestion that it may worsen mood as a result of withdrawal and sleep problems. You may be able to mitigate this by avoiding consuming caffeine too close to your bedtime. In rarer cases in which people have taken a high dosage of caffeine, psychotic and manic symptoms as well as anxiety have been observed. People with panic disorder and social anxiety disorders seem to be particularly sensitive to the effects of caffeine. The DSM-5 recognizes a phenomenon known as caffeine intoxication. Health professionals recommend limiting daily caffeine intake to 400 milligrams, which is about 8 cups of tea or 4 cups of coffee. However, the DSM-5 claims that a dose over 250 milligrams may cause caffeine intoxication in some people. The common symptoms of caffeine intoxication are nervousness, restlessness or excitability, skin flushes, digestive issues, muscle twitching, rambling thoughts or speech, panic attacks, and agitation. In cases of extreme, excessive use, caffeine is associated with a range of conditions such as depressive disorders, sleep disorders, bipolar conditions, eating disorders, and psychotic disorders. There are no known long-lasting effects of caffeine intoxication, but as we age, we're more likely to experience intense reactions to caffeine. Older people more frequently report trouble sleeping or hyperarousal after consuming caffeine. Caffeine intoxication will usually go away on its own, but drinking lots of water for rehydration is advised, as well as taking a walk to alleviate restlessness. It's a given that you should avoid consuming more caffeine during an episode. In severe cases when someone has overdosed on caffeine, medical treatment may be necessary. Patients may be given supplements, intravenous fluids, or activated charcoal, which stops caffeine being absorbed in the stomach. The easiest way to avoid caffeine intoxication is to simply reduce your consumption. Options for reducing caffeine use include reducing the size of your coffee cup, switching out some caffeinated drinks for an alternative, such as fruit-infused water or herbal tea, or choosing a decaffeinated version of your coffee and tea. Coming soon to the Mental Health TV YouTube channel is an interview with an individual who experienced a hemiplegic migraine, which convincingly mimics symptoms of a stroke as a result of too much caffeine. For more information on caffeine and mental health, check out the links in the description section of this video. And remember, your mind matters.